I'm Anna Warnicki in Washington. Right now, governors are having to decide how to keep child care facilities open for essential workers. I'll have that story coming up.
I'm Morgan Wright in Washington. Lawmakers are weighing in on local companies pivoting their day-to-day operations to better meet the needs of healthcare workers on the front lines of the pandemic.
With stay-at-home orders in effect, lawmakers worry what the isolation can do to those with mental health problems. I'm Basil John reporting in Washington, what changes lawmakers and organizations want to see.
I'm Trevor Shirley in Washington, where experts are weighing in on what you need to do to protect your credit score during the pandemic. That story coming up.
Texas Republican Senator John Cornyn says many of our frontline workers cannot battle this pandemic without daycare for their children.
It's not a matter of just convenience, it's a matter of necessity.
That's why Cornyn says Congress included $3.5 billion to keep child care facilities operating as part of the coronavirus relief package.
Child care for people who are, in public safety and the healthcare professions, the grocery stores, etc.
Linda Smith, director of the Bipartisan Policy Center's Early Childhood Initiative, says the money goes to states and state officials must decide how to spend it safely.
This is risky work. They are taking the children of people who are out there and exposed. So governors are now having to think through, how do we make some of these decisions?
Texas Governor Greg Abbott says the 17,000 daycares in the state will now have to start doing health screenings for staff, children, and parents. Lynette Fraga with Child Care Aware of America says the money will also go towards cleaning supplies.
Sanitizing equipment, making sure that they have the materials and resources in order to make sure those spaces are safe.
But she says the $3.5 billion is just a down payment.
But we need so much more, approximately about $50 billion.
She says that would keep daycares operating through summer. Fraga is asking Congress for the additional money in the next coronavirus relief bill. In Washington, I'm Anna Warnicki.
For those with mental health issues, stay-at-home orders and social isolation present serious problems.
These are all elements that are very, very harmful for those who might already be suffering from mental health challenges.
Virginia Congresswoman Abigail Spanberger says it further isolates those with mental health issues. Congresswoman Jennifer Wexton says telehealth is one answer.
I know of people who now are talking to their therapists and counselors virtually. And still able to continue that relationship.
Congress granted $425 million in its latest stimulus package to provide extra assistance for substance abuse and mental health services.
We anticipate that this public health crisis will turn into a mental health crisis.
Dr. Vail Wright with the American Psychological Association says states need to allow mental health professionals to practice across state lines, and insurance companies need to agree to reimburse patients for mental telehealth.
I think that would really help increase the access, and that probably does need to come down from a federal level.
Both Spanberger and Wexton agree and say they will do what they can to provide more federal dollars for those of us who need mental health treatment during the coronavirus crisis. Reporting in Washington, I'm Basil John.
New York Senator Kirsten Gillibrand says Americans are coming together to protect healthcare workers on the front lines of the pandemic.
Everyone is giving their best to help people who need help.
Gillibrand says local manufacturers and even schools are pitching in to provide desperately needed personal protective equipment, or PPE.
The head of SUNY has made 2 dormitories available for beds. She's also used the Fashion Institute to start sewing masks and gowns.
Priya Bathija says the American Hospital Association is challenging manufacturers, businesses, and individuals to produce 100 million masks for our healthcare workers.
We're seeing manufacturers in Washington State and New Jersey change over their their lines so that they can start making surgical masks for hospitals. We're seeing a lot of larger manufacturers like Tommy Hilfiger, Gap, New Balance step up to the plate.
Some in Congress say the issue highlights the need for President Trump to unleash the full capacity of the Defense Production Act.
What we can do under Title I of the Defense Production Act is we can literally go and jump the line.
Rhode Island Senator Jack Reed says the act would prioritize the production of essential needs to fight this pandemic.
We have to have these. Here's the price we're going to pay. And we're going to move these to places where it's needed.
Reed says healthcare workers must stay healthy to help stop the spread of the pandemic. Reporting in Washington, I'm Morgan Wright.
School teachers and students continue to move classes online during the coronavirus crisis, but it's not easy.
In some cases, children live in a location where there is no access to internet. They could not have it in their home if their parents or families were so inclined.
Virginia Representative Abigail Spanberger says teachers have run into their own issues, and Virginia Representative Don Beyer agrees.
It's one thing to have kids in the classroom. It's another thing to essentially individualize lesson plans for every one of the 30 children that you're responsible for.
The National Education Association says 10 to 25% of students in a community do not have access to tools like broadband and the basic computer technology they need to learn.
Our students have very different experiences with access and opportunity depending on their zip code.
National Education Association Vice President Lily Garcia says teachers and students across the country are adjusting, but they need more support. Pennsylvania Congressman Glenn Thompson says the $2 trillion coronavirus relief law was a step in the right direction.
As a part of the CARES package, we did include a large amount of money actually for continued investment in connectivity.
But teachers and students argue they need even more help to keep kids in class while they're stuck at home. Reporting in Washington, I'm Basil John.
There's a lot packed into the $2 trillion coronavirus relief package, but no protections to insulate your credit score.
I pushed for that until 30 minutes before the agreement was signed.
Ohio Senator Sherrod Brown said consumers, especially those now out of work, needed that kind of protection.
We had interest from the Republican chairman, but Senator McConnell and President Trump said no.
But financial experts say you can still help yourself, first by finding out your current credit score.
I recommend people go to annualcreditreport.com just to see what's on there. That's the free resource to get your credit report.
Financial expert Pete Dunn says if you're out of work or making less, you should still try to make at least minimum monthly payments.
As opposed to trying to get out of debt. Trying to get out of debt is not the focus right now.
He also says it never hurts to call your creditors.
Communicate with them, be honest with them. You're not telling them a story, you're just communicating. And that helps because they can mark it in your file. And if there is grace to be extended, by all means, you'll be in line for that.
Even though the relief package won't protect your credit score, other federal policy changes can help.
You know, if you've got federal student loan payments, you're going to be able to defer those. If you have an FHA loan, you're going to be able to put that into forbearance.
Reporting in Washington, I'm Trevor Shirley.
This is the worst of the worst.
Officials say scammers are already using fears about the coronavirus to target the country's seniors. And now members of Congress, like Pennsylvania Representatives Brian Fitzpatrick and Matt Cartwright, are working to put a stop to it.
You're no good. We're on to you. We're going to stop what you're up to, and we're going to find you and prosecute you.
New legislation would provide funds for states to set up legal advice hotlines for older Americans.
A lot of seniors that have relied on people that they've interacted with, whether it be financial planners, attorneys, or what have you, don't have that ability because they're staying at home for their own health and safety.
The hotlines would help combat financial exploitation and elder abuse, as well as help elders access housing and medical care.
People have to approach anything that sounds the least suspicious very carefully.
U.S. Attorney General William Barr says the Justice Department will show no mercy to those who target the elderly during the pandemic.
We have all our offices in the country on the lookout and pursuing them aggressively.
Scams will continue to sneak through, and that'll keep the Justice Department busy as well.
Some states already have hotlines in place, but are operating with limited hours. If it passes, the increased funding would help states expand their efforts, helping more people. Reporting in Washington, I'm Basil John.
Even though presidential candidates are no longer shaking hands and kissing babies, the race for the White House hasn't stopped.
Welcome to our very first Latinos for Trump online town hall.
We're operating entirely digitally.
Trump campaign press secretary Kayleigh McEnany says the campaign is now reaching voters online.
Essentially doing virtual town halls, virtual ways to connect with our supporters.
The Trump campaign says its online campaign reached more than 1 million viewers this week.
It will be very, very frequent, multiple events per week, perhaps one a day.
And the remaining Democratic challengers, former Vice President Joe Biden and Senator Bernie Sanders, are also changing their approach.
I'm sitting in my basement. There's a television studio set up down here. And I'm being told by the people who run this thing for me and staff that millions of people, over 20, 30 million people now, have heard what I'm saying.
And it's not just presidential candidates adjusting to this new platform. Lawmakers across the country are finding new ways to reach voters.
This is wild times, but it's forcing all of us to figure out ways to connect with people.
Texas Republican Congressman Will Hurd isn't running for re-election, but he says everyone in office is trying new strategies.
I'm going to do, some Facebook Lives. I'll do some teletown halls. Continue to interact with folks on social media.
It really is, kind of new age campaigning.
McEnany says while you might not see anyone going door to door, those same volunteers are now making campaign calls from home. In Washington, I'm Anna Warnicki.
Ohio Senator Rob Portman says U.S. tariffs on Chinese goods make it harder for companies like Gojo, the Ohio-based maker of Purell, to get the raw materials they need.
The 25% tariffs that are on those products are costing Purell about $10 million.
He hopes the administration backs off on some of those tariffs.
I hope that by the end of this week we will have a successful outcome there and we will be able to get an exclusion from those tariffs.
He's not alone.
We're concerned that access to critical medical equipment and supplies is hindered by the current tariff policy.
Jason Oxman is president of ITI, a trade group that represents the tech industry. Today, he sent a letter to the United States Trade Representative that listed 62 products impacted by tariffs.
Now, these tariffs are interfering with our ability to get access to critical medical equipment today. We need these tariffs addressed right now.
But this week, President Trump denied reports his administration might remove some tariffs for 90 days.
I didn't do anything about tariff payments. I don't know who's talking about tariff payments.
Senator Tammy Duckworth of Illinois says even if tariffs are removed, the U.S. still depends too much on China.
So we take the tariffs off on China. We're still dependent on China. We need to be able to manufacture our own goods and keep that capacity here in the U.S.
It's unclear if or when the president may announce a change in U.S. tariff policy. Reporting in Washington, I'm Trevor Shirley.
We're fighting for you, and we're enduring all of this together, and we will soon prevail together, making a lot of progress, working very hard to get additional things to New York as quickly as possible. As you know, we took care of the hospital, including personnel, the 2,500 beds that we built just recently at Javits, including personnel. And we opened it up to COVID, and that's something that we also did in Louisiana, and we're doing it in Dallas. So we have a lot of not only hospitals being built, but now we're manning the hospitals because states are, in many cases, unable to get additional people to work. It's just an incredible situation. There's never been anything like this. We're working to ensure that the supplies are delivered where and when they're needed. In some cases, we're telling governors, we can't go there because we don't think you need it and we think someplace else needs it. And pretty much so far, we've been right about that. And we'll continue to do it as it really gets. This will be probably the toughest week between this week and next week. And there'll be a lot of death, unfortunately, but a lot less death than if this wasn't done, but there will be death. We're looking for an obvious focus in the hardest hit regions. Some of them are obvious and some aren't so obvious. They spring up, they come, and they hit you like you got hit by a club.
New poll numbers from the Associated Press show Americans support their state's response to the coronavirus pandemic, but are divided along party lines over efforts from President Donald Trump and the federal government.
Although the federal government was not quick to respond to the threat of a pandemic, it's clearly reacting now in a very, very massive way, especially at the state and local level, with many governors issuing stay-at-home orders. And this is pretty draconian in the American experience. None of us, I think, in our lifetimes have experienced such dramatic and such widespread mandates from the government.
That's why we really have to do what we all know is right.
The Republicans who support Trump love these press conferences, are impressed at him. They believe that he is decisive. They believe he's acting presidential. They believe he's acting wisely and prudently in ways that are going to be best for the American public. Democrats watching him believe that he is ill-informed. He's misinformed. He gives guidance that's neither prudent nor safe, that he misleads the American public, misleads them or deceives them.
The poll also shows an overwhelming majority of Americans agree with measures to control the spread of the virus, including stay-at-home orders and travel restrictions.
I know there are a lot of people that are suffering really very substantial pain, either through illness or loss of income. When this drags on 4 weeks, 6 weeks, 8 weeks, 2.5 months, 3 months, we'll see how the public is feeling then. I would not be surprised that the longer this goes on, the less positive the Americans will look at the government response to this.
Nathan Algren, Associated Press.
I think for our community, the next 3 weeks are incredibly critical. The next 3 weeks are going to determine how effectively we flatten the curve. And remember, flattening the curve means lowering the surge of patients in the hospitals. And that's what's going to be the main factor in how many lives we're able to save.
So most of the rooms will have medical cots. We do have some rooms set up with hospital beds for bariatric patients.
We're not going to have ventilators, and we're not obtaining staffing from the local hospitals. We are here to augment the hospitals.
What kind of treatment and care will they need?
So it tends to be what we call supportive care. And it's things like oxygen and getting out of bed and walking around and staying well hydrated. There aren't any specific medications that cure somebody of this illness. This is more for the medically stable patient who's on the recovery end of illness.
怎么说呢？因为他在那个发热门诊工作的话，因为也不知道自己有没有接触这一块，所以他们就一直隔离在那个203庄嘛，住那边站。然后 知道就是说现在因为我们小区刚刚解封，然后今天休息的话，就是说回来看一看孩子，也是孩子2个多月没见到他。
It's tough to try to plan something when you can't really plan anything.
This is going to be a different experience for all of us.
It's hard enough to lose a loved one, but then to have the traditions that usually bring comfort in a time like this seemingly not available just kind of compounds the grief that families feel.
You know, these are challenging times for a family.
I wasn't upset that couldn't have a ton of people here. It was my dad wouldn't have cared anyway. It was more or less the immediate that was here, and we were all able to make it, so that made it a little easier.
Gloria, you lost a husband. Here again, you don't expect to lose a husband in the 60s.
The most difficult piece of all of this is that the way we gather as a community looks totally different now.
All of it. We'd still talk all the time. Just make the best of the situation the best we can.
It's just too overloaded right now. We've got no one to help because they can't. There's so many people trying to apply for benefits right now that both online and the phones are totally overloaded. It makes it hard to be upset that I can't get through to unemployment. It's annoying, but if I have to go to the family, I can go to my family. There's people who can't do that. It's a problem, and I don't want to have to go ask for help when there's resources put in place for things like this. I'm supposed to be able to take advantage of them, and I can't. My credit card just kind of... But I know that's going to be rough because I'm going to have to make payments on that too, and there's nothing coming in.
Yay! Oh, fare thee well.
I'm not a doctor. I'm not a frontline person in any way. And knowing that the best advice right now is for folks to stay home, I thought maybe I can help by creating something that will make staying home a little bit more enjoyable.
Life must be laugh, kookaburra gay. Your life must be
Yay! One of the things that was joyful was seeing everyone's faces. You know, when you put it in gallery view, you see lots and lots of people's faces, and I could see them kind of singing along and smiling, and especially folks who brought their kids. It was really sweet to see.
I put the teether on the counter and a little mouse stuffed animal that she loved, and she was, paying attention half the time, but she was really stimulated and it was fun, and it felt nice to share that with her.
I think of these songs as medicine in a way for my mind. That's really what I wanted to share, is that there's so much skill in real medicine, in the hospital, but there's also ways in which we can care for ourselves and each other.
I am not afraid. Thank you so much, everyone, for singing together. Lovely to see your smiling faces. Thank you.
Oh, say, can't you see?
whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free?